on page number 69. I left it there. And Parkinson, very important. You guys need to know your drugs on Parkinson patients are. And I'm going to move on. How long a client should take TB medication. TB is, how long do you give them? Long-term medication, 6 to 9 months. How long do we give the medication? 6 to 9 months. How do you diagnose TB? Confirm. How do you confirm TB? A sputum, very good. Everyone remember, what do you do? All your patients you screen for TB, what do you give them? What do we give them here? TB test. What is it called?
PPD.
PPD, and what do we call Montos or PPD? And how do you give PPD?
Intradermal.
Intradermal. Everyone should know. When do you read PPD?
After 3 days.
After 3 days, 48 to 72 hours. What is positive? How much? You're reading millimeter around. 10 is positive. Immune system, 5 is positive. Are we clear? But if they give you patient has 10 that's a positive for TB. And what do you do if somebody is positive? You've got to do chest x-ray. And how do you confirm? Not by chest x-ray, only by a sputum. Are we clear? And what do? You start your patient on TB medication. What isolation do you put them? TB.
Negative pressure.
Airborne. Are we clear? What mask are you going to wear with airborne? N95. What kind of pressure do you have in the room in airborne? What pressure? Negative pressure. There are only two pressure. One goes negative here. Are we clear? Negative pressure. Are you going to open the door or close the door? Close the door. Always remember what is important to wear. Now they're not asking you what all you will wear. They're going to say you're going in a patient's room and you're going to give bath and do patient care. Then you're going to wear mask, you're going to wear gown, and you're going to wear gloves. Are we clear? Because you're doing patient care. Now your patient is preventively and you're treating your patient with TB is TB medication, and they can be longer than 9 months. If somebody has HIV, they may need longer. Next is hepatitis. Let's move on the next box, hepatitis A. What is hepatitis A? Now it says hepatitis, just their thing, and then you have hepatitis A. Hepatitis A, what kind of precautions you're going to take it? What kind of precaution with hepatitis A? Contact. Write down the word contact. How does you spread the infection? Is fecal oral, contaminated food and water. So when we are traveling from one country to another, and we are going some countries, you have very bad water supply, and you can get hepatitis, contaminated food. Infection goes directly to the liver. Are we clear? So what isolation you will take hepatitis A? Contact. What is important in contact precaution? See, I like to review a little bit. This is the way you got to prepare seeing your question. You are admitting a patient with hepatitis A. What do you need to wear? Can you put two patients with together?
Yes.
Can you put together contact precaution, same kind infection?
Yes.
Same precaution, you can put two together. What is the distance between both the patients? At least 6 feet. Are we clear? At least 6 feet distance between two patients. And what do you do when you're putting a patient with hepatitis A? All contact precaution. Do you need to close the door? No. Leave the door open. You got to remember, only you're closing the door in airborne. Are we clear? And now, contact, you leave the door open. Is not with the air, is contact. With your gloves, what is important to wear? gloves and gown and prevent any splash. Even sometimes you have to wear the goggles. And do not remove anything from patient's room, not even blood pressure cuff. That is important. And they're going to throw that. Your patient has hepatitis A and you have to take blood pressure in the next room. And after you finish blood pressure cuff, what do? Leave that in the patient's room. Don't move it, anything from patient's room. So what is hepatitis A? What precaution? Contact. Are we clear? And do you leave the door open? Yes. How do you get infection? Traveling time, fecal oral, contaminated water, contaminated food. And person who has hepatitis A, underline, should not prepare the food for others in your question. Now, I want you to go back on hepatitis on the top. So that is hepatitis A. But what is hepatitis means are, underline the word liver. Where is the problem in hepatitis? Liver. What do you monitor? Your patient is very important is anorexia. They have no appetite to eat, whether hepatitis A, hepatitis B is with the blood, but when they're saying patient has hepatitis, what do you monitor for your patient? Remember, they cannot eat. Are we clear? Why? They have anorexia. And when they're going home, also you got to give them very small amount. And what food? Food is very priority in your question. Where is the liver? Is in the right upper quadrant. So where is the pain is going to be? Right upper quadrant. Color. Underline the word jaundice. Liver can lead to jaundice. And what will be problem here? Stool color, clay colored, tea colored urine. And underline the word pruritus. Why? Underline the word bile salt. ALT, AST is a liver test and they are elevated, and also bleeding time and clotting time, prolonged. So whenever you have a liver problem, it affects your bleeding time. Everyone, ALT, AST, bleeding time, whenever you are looking in your question with liver, very important, anorexia, and now hepatitis A. We already said what kind of precautions we are taking, contact. Hepatitis B comes from blood and a body fluid. So what precaution you will take in hepatitis B? What precaution? No. Hepatitis B?
Droplet,
No droplet.
airborne,
Standard is in the blood. What is in my blood? You don't know. Are you going to put me in isolation? No. How do you treat me? If I have a blood problem, a standard. What is standard means? Wear the gloves. Are we clear? If you are getting contaminated with your clothing, then you're going to wear the gown. So hepatitis B is blood. What precaution? You will go standard. C, same thing. And who is high patient with hepatitis B? Drug abuser. Underline the word dialysis patient. What is the complication of dialysis? Hepatitis. That's your answer. See how you twist the question around it is hepatitis and dialysis. Vaccine. Do you give vaccine for hepatitis B? Yes. We give 3 injections with hepatitis B. Hepatitis C, same thing with body fluid. What precaution? Standard. Underline the word hemophilia. Patient also have hepatitis C. Hepatitis C is again with the blood. So B and C and D all are blood. Only A, and write down E where you have A, are your contact precaution. Everyone is okay. Only hepatitis A because it's going fecal oral, and E, B, C, D are your standard precaution because they are from blood. Nursing care of a patient with hepatitis. Number 1, rest. They get tired easily. Very important, you do bed rest. Precaution, either contact and standard, depend what hepatitis they give you. Diet, very important to answer. If you're dealing with hepatitis, questions are, number 1, rest, and then you go number 3 line. is low-fat diet. You got to cut down with liver fat. You give calories. But how do you give calories? I want you to add there increased carb, fluid, juice. Protein is important for healing of the liver. So juice is good, carb is good, but protein is good. But what do you cut down? Add their carb, because a lot of question I came across and they have increased carb because you need energy. That's why carb gives you energy and they digest easily. But you got to cut down is the fat. You can, no alcohol, liver damages alcohol. Vitamin K for bleeding, and Dramamine or Tigan for vomiting. Underline that. So we all know antiemetic medication, you can give them Tigan, Dramamine, and steroids. You can give them for inflammation. And lotion, because they are itching problem. So everyone remember, very important in hepatitis question, you should set in your mind. Your questions are going to be give rest. If they're going home, they should not go back to the regular work. They should start slowly back to the work. Why? Because their energy level is very... See, your questions are, patient is going home after hepatitis has been treated. What would you instruct your patient? Rest and don't go back full-time job. You start few hours a day, cut down. And also drink more carb and juice, because juice is your carb and their sugar, so more energy level. Cut down fat, that's important. Now I'm going to move on, Lyme disease. Very important that we all know for Nclex, your isolation as we are moving on, and your Lyme disease. It's underline the word multi-system. And Lyme disease has 3 stages. How do you get Lyme disease? From tick bite. So write down underneath somewhere, wherever you guys have room, ticks. And where do you find these ticks? Is in wood areas. And prevent from tick bite. So whenever you're going out, make sure you cover the skin, long sleeves clothes, and avoid going out in summer, very common in summertime. So summertime and tick bite and tick area and woody area. I want you to guys add that. And if somebody has a tick bite, what do? Remove the tick with tweezer. Take a tweezer and you remove the tick. And wash the skin with antiseptic. You clean the skin with antiseptic and dispose the tick in the toilet or sealed jar. Either you put them in the toilet or a sealed jar and take it to the hospital so they can test what kind of tick is there. Are we clear? So in your question, you must know, cleaning with antiseptic and blood test. I want you to add, because you don't have blood test. When do you do to diagnose them? 4 to 6 weeks after, because you will not see before. So 4 to 6 weeks after the bite. And they draw the blood to diagnose the tick bite. So when do you diagnose the tick bite? After 4 to 6 weeks to draw the blood. Now I'm going to move on. So we all know that Lyme disease comes from the tick bite. You draw the blood 4 to 6 weeks after, not before. And what do you do with the tick? You put them either the toilet, use the tweezer, and maybe you can put in a sealed jar and take it to the hospital. Now, what is a multi-system disease? It affects everywhere. Stage 1, they have lesion and they call erythematous papular. And underline the word bull eye. Shape of eyes as a bull. And the shape of those rashes are like a bull eye. Some question, they will throw that. And they may give in the picture. So it more looks like a bull eye shape. So, and what is the rashes are? And then underline the word lymphadenopathy, lymph nodes enlargement. Starting with flu-like symptom. And fever, headache, and can develop 1 to several. It takes about 1 to some months when they are in stage 1. Rashes they have, lymphadenopathy, they have fever, they have flu-like symptom. Stage 2, after 1 to 6 months, if untreated, underline the word cardiac, heart, it affect neurological, underline the word, paralysis, Bell's palsy or paralysis. So cardiac, neurological problem. Third stage, very important, after several months. And if they're saying arthralgia, or write down the word arthritis, bad arthritis, and write down the word large joints. They have even the big joints involvement. So when in your question, patient has Lyme disease and the joints are very painful, arthralgia word, arthritis, what stage you are? Third stage. And that is third stage. Then we'll move on to the next page. So everyone is okay, tick bite, Lyme disease. And Lyme disease is bull-eye rashes, very important word is. And what are some of Lyme disease teaching? What do you teach them? We already talked about covered area, check exposed area, woody area. What is the Lyme disease nursing care? You will do it. You've got to treat them by giving antibiotics. So dicloxacillin, they can give them, or IV penicillin is a strong antibiotic you give them in third stage of the bite. So IV, they need to give. But how do you treat them? By giving is what is antibiotic. Everyone is okay, Lyme disease. Now those are coming in the exam. So don't be surprised when you get any question on Lyme disease. Transmission, syphilis. This is sexually transmitted disease. Underline the word. Now there are 3 stages you don't have here, but I want you in the middle or somewhere on the side, write down the 3 stages. 3 stages they have, and they may use the word primary. Primary means first, or early stage. When they are primary or early stage. And what is important, underline the word, they have rashes, and underline the word, the rashes are called chancre. Painless chancre. Chancre means rashes. Whenever you use the word chancre, they only give for syphilis. So chancre they call them, and they are painless. Then second line, underline the word fever. Then the rashes are on the palm and the sole. That is in your primary stage. And also, I want you to add in primary stage, lymph node enlargement. So they have rashes, and now they have enlargement of the lymph node. I want you to write down secondary stage. Now, secondary stage, they have low-grade fever and rashes. They have rashes, and because of rashes, they're itching, and sometime in question they will say patchy hair loss. I was doing one question, and they were saying patient has syphilis and patient has patchy hair loss. What is that stage? And the answer was secondary stage. Are we clear? Because they are itching, and their rashes, what happens? When you get a lot of rashes, you start losing the hair. So they are forming the patches. Patches, hair loss patches that will go there, and they have low-grade fever, and the rashes are there. Tertiary stage. Tertiary means third stage. Sometimes they don't use the word third stage, but they're saying tertiary stage. In tertiary stage, I want you to write down involvement of the heart and nervous system. In the nervous system, they will say the word arthritis. And there another word, they have leg cramping. Neuro, because it's the neurosystem, the nerve are causing a lot of pain. And there was a question, and they said patient is complaining leg cramping, and patient is in what stage of syphilis? The answer was third stage. Are we clear? So everyone, syphilis comes from sexually transmitted disease, and they have 3 stages. And write down the word tertiary, Tertiary. Tertiary means third. So remember, Primary stage, I told you for chancre word is important. Chancre. Now, so remember, we have a lot of communicable disease coming in Nclex. So I don't want you to get surprises, not to know. I do cover this in OB section. But now, I'm very happy that those things are not in Spider-Man, but you do have it here. So primary stage, they have chancre. Secondary stage, remember patchy hair loss because they have rashes. And tertiary stage, remember leg cramping because of nervous system. They also involve heart and arthritis. Are we clear? So there are 3 stages of syphilis. And it comes from sexually transmitted disease. Now, we all did all that in syphilis. Now I want you to go back in your box. It says treatment. How do you treat them? By giving antibiotic. Penicillin. Penicillin is a strong medication. Used it, and if patient has allergy, they use erythromycin. Underline that. Always check for allergies. If somebody is allergic to penicillin, you can give them, but they can give them erythromycin. So everyone is okay. Syphilis is 3 stages of syphilis. How do you treat them for syphilis? I want you to add diagnosis. How do you diagnose them? On the side, there is a blood test, it's called VDRL, but there is very common, they give an exam, FTA test. It's a blood test. What is F means fluorescent. FLUORSCENT. Fluorescent. And then you add there trypnomial antibodies. TREPONEMEL. Antibodies. Now, there was a questions in your exam cram book, Saunders book, how do you diagnose syphilis? And the answer was FTA. This is a common blood test. This is also blood test. But what are they looking here is antibodies and fluorescent trypnomia, because this is the causing syphilis, trypnomia pallidum. Are we clear? So they see fluorescent trypnomial antibodies. So that is a test, FTA for syphilis. Are we okay? How do you treat syphilis? By giving antibiotic. And 3 stages of syphilis. Now I'm going to move on. The next is transmission and sign of gonorrhea. And underline the word female. Asymptomatic. Any question? Female has no symptom but unaware of disease, and male is having thick, and underline the word discharge from the urethra. So male is having thick yellow, add the word yellow discharge. So yellow discharge, or if they give thick discharge only in the male, female is not having any problem, that means sign of gonorrhea. Some female from vagina spread to the mucous membrane and causing congenital problem in the babies. And what does it lead gonorrhea in the babies? The blindness. That's why you got to put eye drops for the babies. And how do you treat them? Gonorrhea is by antibiotic, dicloxacillin, penicillin, and also used for gout, used with penicillin because it delays urinary excretion and it makes it more effective. So dicloxacillin, or you can give penicillin. And complication, very important for female, is pelvic inflammatory disease. And most often affected with chlamydia, treated with, underline the word chlamydia. That's also sexually transmitted disease, and we will be talking about that, and you treat them with tetracycline. Everyone remember, why do you put in baby's eye the medication? To prevent blindness. For which mother R? For gonorrhea. And what is the female R? Asymptomatic, and male has thick discharge, and that is sign of gonorrhea. And how do you treat them? By giving antibiotic. Next is herpes, genital herpes, are no cure, and they have underlined the word genital lesion, excavation and remission. What is the meaning excavation? What is excavation? You got to know these two words. Exacerbation means it flares up, acute. Remission means they are okay, not flared up, they are feeling okay. Exacerbation means acute. So any question, if they give you, your patient has exacerbation, meaning your patient is very sick. Remission means you don't need to worry because they are in remission. They are okay. All right? So exacerbation and remission, that means the disease doesn't go away. Disease is always there. Underline the word, how does it herpes get worse? A stress, period, your hormones, and infection. And can lead to spread by contact. So don't let the baby come through the normal delivery. We are going to talk about that in the last line. Treatment, acyclovir, your virus medication. And for patient with herpes, sitz bath, pap smear can be done to check if they're turning into cancer. And last line is C-section. That is important for OB. Mother is having genital herpes, do not deliver them normally. How do you deliver the baby? C-section. What does it cause? The baby's infection, congenital problem. This genital herpes can lead to congenital problem, and how do you treat them? Antiviral medication. Chlamydia is another problem. What is chlamydia? Urethritis, causing infection, difficulty urination, and woman has thick vaginal discharge. Underline that word, vaginal discharge. And it can cause congenital problem, underline. So if mother is pregnant, baby can get congenital problem. Treatment is all antibiotic, dicloxacillin, and underline the word sterility, very important. What do you monitor for your patient with gonorrhea, pelvic inflammatory disease, chlamydia, sterility? They may not be able to get pregnant. So it can lead to sterility. Next is wart, venereal wart, and the wart are lesion. When they are saying wart means lesion. And they become like cauliflower cluster, small, but they make like a flower. It can be in the female vagina and on the male. It causes itching and spread by mucous membrane. And if mother has venereal wart, congenital problem with the babies. But very important, how do you get the wart? I want you to write down by HPV. HPV, human papilloma virus. It's a virus. And also write down HPV is leading also to, they're leading to wart, and HP lead to cervical cancer. That goes in your cervical cancer question. How does the mother and how do you get cervical cancer? Your answer would be HPV, human papilloma virus. What is HPV is causing? The wart and cancer. Are we clear? And those wart can be treated as a cancer. So how do they treat them? So look at that treatment. Curettage. What is curettage? You have to remove them. Cryotherapy. By using liquid, you can burn those tissue, and that is called cryotherapy. I want you to write down anti-neoplastic medication. What is anti-neoplastic? Cancer medication. So anti-cancer medication or anti-neoplastic medication are 5-FUO. Write down that 5-FUO, 5-FUO. That's the name of the medication for cancer. So they can lead to cancer. So they are treating because there's a growth, and either they remove it, they burn it by whenever they say the word cryotherapy, you're burning. Are we clear? And how do you burn them? By using nitrogen gas. It says here is a liquid nitrogen. Then avoid contact until lesions are healed. Is genital problem? Underline the word cancer. Wart can lead to cancer. Now in your question, what is wart are come from where? HPV. And what is HPV is leading? Cervical cancer came in Nclex. And also write down cervical cancer is common by HPV and multiple sexual contact. And early sexual history. People who are involved very early age with sex and multiple partner, those are your answer was in some questions. Are we clear? So everyone should know venereal wart can come from HPV and thing. I want you to add, before I go HIV on the top, there's another disease, is caused trichomonas infection. So I want you to write down, because I do cover all of them in OB, because they are very important for your Nclex, because all infection, prevention, monitoring, those questions. So write down the word trichomoniasis. Trichomoniasis. Trichomoniosis. And what kind of discharge the patient has here is yellowish. The female has its infection, and yellow to green color. When you're seeing a frothy, like a lot of froth, and mucopurulent discharge. So frothy, mucopurulent, like a pus, yellow to green color, that's a sign of trichomonas. And they have bad odor, malodorous. Whenever you see the word malodorous, that's not good. That's a bad infection. It can lead inflammation. This is infection, trichomonas, and they have this kind of discharge in female. Inflammation. It can cause inflammation of vagina. And also, how do you treat them? Only by antibiotic. And cleanliness during period time, changing the tampons, washing, very important that maintain cleanliness. Antibiotic, they give them Flagyl. Write down the word Flagyl. Flagyl is very common antibiotic, used in a lot of patients with this infection, ulcer patients, liver cirrhosis patients. So Flagyl is antibiotic, and very important teaching for us is tell the patient no alcohol. And if they are for 2 weeks and 3 weeks antibiotic, they cannot drink any alcohol. They can go into seizure. Very important teaching for Flagyl. So what is I said to add here, so you guys already know gonorrhea, syphilis, and herpes, you need to know chlamydia, you need to know, and wart, HPV, and cervical cancer. Are we okay? Now I said trichomonas, you're treating by medication. I will move on HIV question. HIV is positive AIDS in the blood. Presence of HIV is in the blood. AIDS has significant, AIDS lead to, underline, very important, immune function. Positive HIV develop opportunist, very important, you guys all know, opportunist infection. And what is they have? Immune system. You may be putting that patient, when they have immune system, in reverse isolation, because their immune system is low. Very important, HIV lead to what? Opportunist infection. That is important word. I will move on to the next. Symptom, when there are risk for more infection in your question, when their CD4 count are below 200. So they're looking in the blood, and if they are saying patient CD4 is less than 200, the risk for infection. Are we clear? And they will use the word opportunist infection. And what are the infection are? Pneumonia, carny pneumonia, is opportunist infection, is carny pneumonia. Dry, non-productive cough. So if ever you have is opportunist pneumococcus, carny pneumonia, P pneumonia, carny pneumonia, that is opportunist. Where do you see this? Patient with HIV. Are we clear? CD4 is less. Albicans stomatitis, underline the word. Candida, C means Candida albicans. What is Candida albicans means? The mouth. They have like a thrush, swallowing problem, white patches in the back of the throat. So remember the word C Candida, their stomatitis. So if they give you, what are the opportunities to infection you're monitoring for HIV patient? Number one is cardiac pneumonia, number two, stomatitis, and C, new form is meningitis, underline the word. They can lead to seizure. They can lead to cytomegalovirus virus, comes from HIV, and also visual impairment. Last one, Kopatsky sarcoma, that is on the skin, malignancy, exposed with AIDS. And what is the sign of sarcoma is purple, brown, non-painful, non-pruritic, and also lesion on the body. So there is a lesion. Everyone, very important for Nclex. Everyone should know pneumocytic pneumonia. Cardiac pneumonia is for HIV patient. What are the symptoms? Are non-protective cough. Very important, CD4. It's a pneumonia, but they are treated with antibiotic. But remember, who is getting for patient with HIV? Second thing you remember is stomatitis. Third thing you remember, seizure, cytomegalovirus virus. Whenever you have cytomegalovirus virus, it can lead to visual impairment. And sarcoma means the lesion. How AIDS is transmitted? Underline the word body fluid, only with the body fluid. Sharing needles, sexual contact, and HIV viral culture, you will do it and it lead to leukopenia, thrombocytopenia, bleeding disorder, decreasing CD4 count. So everyone remember AIDS is transmitted with body fluid, sharing needle, and mother's milk. Very important, and when the baby mother is pregnant, it can go transplant through the placenta. So those are your body fluid. So you can put them in a standard precaution, but when their immune system is low, then they need to go in reverse isolation. Now, what are your diagnoses? Underlying ELSA test, Western blot, then you do leukopenia, viral culture, CD4 count is less than 200, remember. Nursing care, prevention, avoid IV drug use, precaution regarding sexual, standard precaution. Usually HIV patient is standard. Contact and standard precaution. Protein is important in the diet, calories important, and small frequent meal rather than 3 meal. And don't share toothbrushes and shavers. Why? Because of the blood. And that's why don't share them. So very important is your AIDS. These are communicable diseases, and AIDS questions are basically you can go for standard precaution. If they're CD4 20 less, then 200 and less, then you put them reverse isolation. Now I'm going to go any poison control question. Now these are very important for Nclex, all preventive diseases and also poison control. Prevention most important, treat the patient first. And recognize sign and symptom. So any poison case, first thing you should know sign and symptom, accidental poisoning, underline the behavior, and substance around the mouth or stomach or vomitus. Save the vomitus, save something around the mouth. So first thing you recognize what's wrong with the patient. Next is what should happen, someone is in poison. What do? Call the poison control. That's very important. And number 2, second line, tell them substance, what substance they have taken, what time, amount, and route of ingestion, how they have taken, swallowed, inhaled. What is the age group of the child or a person, their weight, and save the vomiting, stool, anything coming out from the body, stool, urine, and vomitus, save them. So first thing is called the poison control, anything safe. Next is, what medication do you use to induce vomiting? Underline the word syrup of IPEC with small amount of water. So mix it in the water, small IPEC, you can use it. Do not give large amount of fluid. After you give IPEC, don't let them drink a lot of water because it's going to dilute it and will increase gastric emptying. Don't use milk. Position with lower with the chest. So best is for vomiting, IPEC, you take that, and prevent aspiration. No universal antidote. There is no that you can use it for, you have to go as you're going. In emergency, somebody taken a poison, their respiratory problem, underline the word is intubate. If they're not responding, do the blood gases, ABG, arterial blood gases, cardiac monitor, gastric lavage, you will go for, and put with the, what is lavage means? Irrigation. Write down the word. Gavage means feeding. Lavage means you're washing out the stomach. And activate charcoal. May use catheterics and diuretics. Now, for treating in emergency, activate somewhere you can use charcoal. Maybe the diuretics they can give them. And also, what are the sign and symptom treatment care and prevention of aspirin. Now this is general. I'm going to move on different categories, and that is very important for Nclex. So poison control, IPEC word, activate charcoal is good. And next is, you will go on, what are the sign and symptom of aspirin? Underline aspirin toxicity. Is tinnitus, ringing of ear. Temperature can go up. Underline bleeding. Everyone remember, ear is affected with too much of aspirin. They're bleeding. And also nausea and vomiting. Induce vomiting in nursing care, hydration, sponge bath, and monitor for bleeding. I want you guys to write down, if you have aspirin toxicity, number one, they can give them, so on the side, I want you to add some more thing. So aspirin toxicity, you can give activate charcoal. So write down lavage is okay. Lavage means washing out the stomach is okay. Irrigation is okay. And activate charcoal is okay. If you have a patient with aspirin toxicity, you can give activated charcoal. Number three is you monitor patient for acid-base balance, okay? And the meaning is metabolic acidosis. So your aspirin toxicity, they're doing metabolic acidosis. And what do you give for metabolic acidosis? Write down sodium bicarbonate. You can use it, sodium bicarbonate. So very important, active charcoal, soda bicarb is okay. Number four is, because they're bleeding, vitamin K can be given. Next is for bleeding control. And number five is you will go dialysis. So if your patient is really bad in aspirin toxicity, they can also go for dialysis. Now I added few things. And also they can go in convulsion and coma. So side effect, you guys have bleeding, vomiting. On the side effect also, I want you to add there, they can go, aspirin toxicity can lead to convulsion and coma. Your patient can go in coma and convulsion. So these are your extra treatment. Now a lot of questions are coming for antidote, and a lot of questions are coming if your patient has aspirin toxicity at home or wherever. What do you do? It's okay to pick up your answer, lavage. You can do second thing, activate charcoal. You can give them soda bicarb to prevent their going in metabolic acidosis. The risk for bleeding, you can give them vitamin K. Maybe you can give them hemodialysis, monitor your patient for convulsion and coma. So add all those treatment. I have added here just for you guys. You never know what answer you're going to get it, okay? Now, next thing is prevention of Tylenol toxicity. Tylenol toxicity is underlying the word nausea, vomiting, hypothermia, very important, liver involvement. Too much of Tylenol is damaging liver. So in the second box, underline the word hepatic and liver, and patient would have pain right upper quadrant. Write down the word right upper quadrant. Underline the word jaundice. Underline coagulation. How many problems with your patient when they have Tylenol toxicity? You have jaundice, bleeding, pain, nursing care, induce vomiting. What do? Induce vomiting. It's okay. And check liver. Check AST. Tylenol overdose medication antidote is Tylenol acetaminophen. Overdose antidote and acetylcysteine. Underline that. Very important for your Nclex. What medication do you give if they have Tylenol toxicity? And acetylcysteine, which is called mucomist. You are using in respiratory patient in mucomist. I want you to write down is toxicity of Tylenol, write down on the top, if their plasma level, that means blood level, is 300 mcg per ml in 4 hours after ingestion. So somebody takes Tylenol and their blood level is 300 in 4 hours, that's a toxicity. 50 mcg per ml in 12 hours. After 12 hours, even you have 50 mcg, your patient is having toxicity. So that's a blood test. In a blood level, 300 mcg, patient is in what? Toxicity if 50 in 4 hours. In 4 hours, your blood level is 300. Your blood level 50 mcg in 12 hours, your patient is what? Toxicity. Are we okay? So that is important that we are looking in the medication and in there. The next thing is lead poisoning. I want you to write down what is another word for lead poisoning. Some of the book, when you're doing question, they have another name for lead poisoning, and some books have, some don't have. But I want you to add the word. It's called lead, the word L-E-D, lead. Lead poisoning is called plebiscin, Plumbbism. So this is the word they gave. What is plebiscin is lead poisoning. And lead toxicity and lead poisoning is called this word. So add there in their lead toxicity. And we already did the drug for lead toxicity, but you have, what do you monitor for your patient when they have lead toxicity is, number 1, irritability, abdominal pain. Underline the word ICP. That means it affects the brain. Diagnostic test, blood level more than 9 mcg is toxic. Erythrocyte porphyrin, PEEP, is causing toxicity, and underline the word X-ray. Long bones, lead deposit. So how do you diagnose the blood test? And X-ray will show lead is deposit in the bone. And child engaged, ingested non-food substance, maybe a paint, maybe something is not directly, but how do they get the lead? In their toys. Old furniture, old houses has lead. Bloods, hemoglobin, and underline the word kidney. And also write down the word neurological problem. So they have hematology problem, bones are affected, neuro is affected, And also write down mental retardation. It can lead to mental retardation. Nursing care. Underline the word chelating agent. And what was the chelating agent we have done is BAL, and write down the word chelating agent. These are the name we did, BAL and EDTA. So write down right there. These are the name we did in the drug. That's the name of medication, EDTA and Sucamol. We did in few pages earlier in the morning. So, but they use the word chelating. So when they're saying there is poisoning, so what do? Chelating or chelation therapy or chelating. Chelating word is, if they didn't give you drug, they may use the word chelating therapy. Are we clear? So everyone should know lead poisoning is very common in the children. So in Pete's question, lead poisoning can be asked, and where does lead poisoning, can you diagnose in the blood? And you're looking on the bones because it deposits on the long bone. And it can lead, how do you treat them? You got to remove the lead poisoning. And how do you get the lead? On the playground, old house, furnitures, paint, on the glass paint, some of them has a lead. So those are the way you're getting. Next is on this page, you have nursing care goal for hazardous waste. What is your nursing care for hazardous waste are? Is decontaminated individual spread. Why are you using? So how do you prevent infection? You are preventing what? Hazardous waste. And why? Prevent of contamination. And what are you using? Is you're using biohazards container. Write down the word biohazards container. All your waste should go, your needle stick, all your needles should go in a biohazards container, the bottle. Biohazards waste means you're preventing infection. What are the nursing care for biohazards are? If chemical, threat caregiver discontaminate patient first. If chemical, that means you take care. And protective garment, and write down last two lines. Hazardous waste and protect your contaminated gowns, your mask, your gloves, contaminated. And where do you throw them? In infectious waste. That is the wording you got to know. Now we will move on a little bit on the peds, and I'll stop here, and I think let's take a quick break, and then I'll go on the peds section, okay? So we'll take a little break. I know you guys look tired and sitting, so we got to take a break. And then